Bluetooth off on your phone? It's off on my computer. Oh, is that what you were playing music? I was playing through. Yeah. Okay, it's off on my phone too. All right, I was gonna try to. Yeah, go for it. Hello,
Hi.
Valeria.
Yay.
All right. We'll probably get going at about 5 after. I'm going to see if anybody else can join us, okay?
Sounds good. Thank you.
Hi, Crystal. I'm just waiting until about 5 after to get started, okay?
That's fine. Hi.
All right. Well, looks like it's going to be just the 3 of us. So I know Valeria was in here the other day, but Crystal, I don't think you've been in a lecture with me. And I'm not sure if we've corresponded on email. I just want to let you know I'm Christina. Put a name to the face, a face to the name. I've been a Sun State teacher here in Clearwater since October, and I've been a massage therapist for the past 12 years. So a little about me. Does anybody have any questions about any emails or anything that you've been getting before we get started with the lesson today? I've got the chat open as well if you don't want to use your mic.
No, I don't think I have any questions about any emails.
Oh, sorry, let me turn my volume up. One more time.
I don't think I have any questions about any emails.
Okay, cool. Thank you.
Mm-hmm.
All right, Crystal, you're good?
Can you hear me?
Yeah.
Oh, okay, perfect. Yeah, I can. Everything's good. I'm actually, wait, can I ask a question?
Yeah.
About the hours. I'm a little confused, and so is another girl named Whitney. We're in the same class, but we weren't
on the daily trackers.
Yes.
Yes, that format was from, we got our daily tracker format from Cosmo, and their online program is different from what we're using. They're using Lab and we are using MindTab.
Right.
Lab has a clock-in feature.
And
MindTab does not. So that don't need to worry about. It's just something that we didn't catch to pull off of our version of it. That was our mistake.
Because my whole class was freaking out about it, wondering if we just lost all of our
hours. Nope. Your hours come from the completions when you send stuff in and you see at the bottom where it says, do this, do that, do this, do that. And if there's time equated with each task, that's how you guys are getting your hours.
Okay, perfect. Thank you.
Yep. Nope, no problem. Okay, so let's jump into it. We're doing special massage for special populations. That's, I believe, especially important for us being in Florida because we have a very special population here, the over 55. So that's kind of why I like this chapter, because they do need a little bit of extra care, but there are some other groups that we need to talk about as well that you might need additional training for, that that just out of the gate you you might not be prepared to take on as your clientele. And there's so many CEUs out there to expand your ability to work on these people. And every time you take a CEU and get something into your belt, it just makes you that much more of a dynamic therapist. So first thing I want to go over is the learning objectives for this chapter. And we're on page 721. And you will need a highlighter and a pen if you want to take notes as I talk. What I'm going to do is basically read through the chapter and then just kind of discuss in small portions what we've just read through, kind of break it apart. You can ask questions like section to section, or we can save questions till the end. It's up to you guys, however you want to do it. We'll work with whatever you want. So our learning objectives are: explain the benefits of prenatal massage, demonstrate proper positioning when massaging a pregnant woman during each trimester, explain the contraindications for prenatal massage, describe various maternal concerns by trimester that are considerations for prenatal massage, practice a basic routine for infant massage on a life-size doll, describe the benefits of infant massage, explain special considerations for providing massage services to children, differentiate the considerations for working with older clients who are frail and those who are active, explain the accommodations and considerations for providing massage to people with various disabilities, explain the major considerations when providing massage to people with cancer, and explain accommodations and considerations for providing massage to people in hospice or who are in end-of-life care. That's another, oh, did I get somebody else? Whitney, hi. Okay. And I think, Crystal, you said that you and her had the same question about the time clock. Whitney, the time clock on the time sheets or the daily sheets, it's from Cosmo, just disregard it. Oh, I think she bumped off. Uh-oh. Wait a sec. Can you hear me okay, Whitney? Cool. I gotta watch making my weird faces. It always freezes on YouTube on a horrible face. All right, so why study massage for special populations? The massage therapy student should study massage for special populations because as the field of massage therapy grows, people of all ages and abilities are experiencing the benefits of massage therapy. Massage therapists have increasing opportunities to work with expectant mothers and infants. Young people benefit from massage for the same reason as adults. The mature or elderly and critically ill benefit physically, mentally, and spiritually from the healing power of touch. Learning how to work with individuals with diverse populations will result in more career opportunities for emerging and experienced massage therapists. It is important to understand and adapt massage to fit the conditions of various populations. So it's really important to be able to, whoever comes through your door, that you've got at least the know-how to send them to the proper person or the tools yourself to, yes.
So I have a question because you just mentioned demonstrating. How are we expected to demonstrate it? Like, is it through video? And also, what if we don't have a life-size doll?
No, that's just to, it's the learning objective. They want you to know how. We're not expecting you to send us a video of doing it, right?
Oh.
So you're to understand the steps of doing it, not necessarily demonstrating it for us. I know the book gets kind of wonky on wording.
Oh, okay.
Yeah.
Thank you.
And in the future, we're not going to send out those daily sheets because we have discovered that was an error on our part. Too much confusion. So when there's extra that you need to do additional to stuff that's not formatted for MindTap, we're just going to pop a little email like, hey, all of your stuff is available. Let's do this little extra bit. And it just equates to time on those sheets. But I think it was nice for you guys to be able to see how we are quantifying your time. So any questions so far?
I don't know if you guys said it already, but I was asking about I did see it on that little sheet. It was saying like a
The time clock.
and I was just like,
Yeah, that was left over from the sheet we got was formatted for Cosmo first, and then we got it, and it's just we didn't take it off. MindTap doesn't have a clock in. You don't have to worry about that.
okay.
So your time is quantified by completing your tasks. So don't worry about clocking in and out.
Okay.
MindTap doesn't have that function.
So
Right?
are we doing away
Hi,
with this
Adrian.
all together?
In the future, we're just going to send you if there's anything additional that doesn't show up on MindTap. We're just going to shoot an email going. Usually what it will be is at the end of the chapters, you see the chapter review questions. And MindTap doesn't format those to go into their digital Beck book. So we'll send that as also complete chapter review questions at the end of whatever chapter you were lectured on that week. So like this week, it will be, oh, where's the page? I'll get there. Yes, so questions 1 through 19 on pages 752 and 753 this week. And you can just write those on a piece of paper, snap a picture of them, send a Word document, whatever's easiest for you guys. So, anything else before we go? Or before we move on?
Is it okay if I mean, I have my camera on because I like to just raise my hand if I have a question, but like I was about to start eating. Is that okay?
If you mute your microphone, yeah, and if you wave just before you start talking, I'll see you, or just pipe in.
Okay, thank
I'm
you.
here for you guys. All right, so the introduction. Massage in some form is beneficial for nearly everyone, male or female, young or old, active athlete or sedentary businessman. This chapter focuses on certain populations that can benefit from special considerations when providing massage services. Go ahead and start highlighting here. Because of unique physiologic needs or characteristics, certain segments of the population require or at least benefit from physical assistance, special positioning, and adaptation of massage techniques to accommodate the particular conditions that client might present. Continue highlighting. These groups include pregnant women, infants, children, older clients, people with disabilities, critically ill patients, and those who have cancer or are in hospice care. And that's the end of the highlight. This chapter introduces how to address these special concerns. However, students who want to specialize in massage for such diverse populations are encouraged to seek continuing education courses from a qualified instructor. While you're in school, you will get kind of a introductory to how to deal with these. But of course, for like prenatal, you're gonna need that actual certification before you can perform massage on pregnant women. You have to learn all the ins and outs of what you can and cannot do, how they can be positioned, and everything that goes along with being pregnant. Right? Because the body takes a beating. All right, so let's explain prenatal massage. During pregnancy, a woman's body experiences many physical and hormonal changes to accommodate the gestation and delivery of a baby. Physical changes include an enlarging abdomen and breast and weight gain. Go ahead and highlight here. Strain is increased throughout the body, but especially on the lower back, hips, lower extremities because of increasing weight. So you can imagine lugging around this big old baby for several months. That strain on the low back, you know, you put some weight in the front, they're instantly going to start cantilevering with their spine to create a whole new center of gravity. So what that's going to do is going to create a whole new pattern for how they move. And so all this musculature that's used to moving a certain way is now moving in a whole new pattern and active in a whole new way. So they're going to experience a whole new set of aches and pains. So just another cherry on top of delivering a baby. Hormones that soften ligaments and other connective tissues in preparation for birth also can play a part in emotional swings that sometimes expectant mothers experience. I'm giggling because I'm pregnant, so that's just, yes. In normal healthy pregnancies, massage is often beneficial to both mother and unborn child. Properly applied massage may aid in relaxation and sleep, reduce pain, and improve maternal and fetal outcomes. Prenatal massage is performed like regular massage, except for the considerations discussed in the following sections. So we have to have special considerations for expectant mothers. Some pregnant clients appreciate your assistance onto the table into a comfortable position. Like we said, we put a big old belly in the front of them. Their center of gravity is different, so their balance may not be as accurate as it once was when they weren't pregnant. So being able to assist them into the table is going to be a good idea. You know, we can put them in a wrap and then have them go under the sheets, and then they can remove their wrap under the sheets or keep it on, and they'll have access to enough of the body, just so they don't have a tumble and fall, because that could be dangerous for her, that could be dangerous for the baby. Go ahead and highlight this. Have several bolsters and pillows on hand to provide comfortable positioning. Right, so you want to have an abundance, you want to have regular shaped pillows, we want to have bolsters, wedges if we can find them. They make special pregnancy setups you can get from Massage Warehouse or Universal Companies to accommodate a pregnant woman. A bathroom and a robe should be easily accessible because the growing fetus tends to press on the mother's bladder, prompting frequent and urgent urination. Plan on relatively short massage. Most pregnant women past 30 weeks of gestation may not be comfortable when lying down for more than 45 or 50 minutes. Women often comment how pleasant and soothing it is to receive a massage during pregnancy because of its calming and reassuring effects. So it kind of has a mothering effect for them and just calms and soothes them while they're going through this really big change. All right, positioning. The client can assume several positions depending on which is more comfortable and how far she is into the pregnancy. Early in the pregnancy, before the abdomen starts to protrude, the prone and supine positions can be used. As the fetus reaches umbilical level, special considerations must be made in both positions to provide comfort to the mother and safety of the fetus. Right. So if you look on page 723 in figures 19.2 and 19.3, we see two different considerations for positioning. In 19.2, let's go ahead and highlight the description there. In the supine position, the pregnant client should be supported in a semi-reclining position to prevent pressure from the fetus on the major abdominal blood vessels. Most of the time, when they're positioned like this, I've seen the esthetician tables that have the tilting top be used more so than the stack of 7 pillows, I think it is. Oh, it's only 5. It's only 5. But if you don't have a table that tilts upward, then you're going to have all of these cushions in place if you're going to be performing prenatal massage within this position. I think the most common position we see is the one next to it, the side lying position. And go ahead and highlight that description there. The side lying position is a comfortable position to use throughout pregnancy. When the client is on her sides, pillows are placed under her head, abdomen, upper knee, or between her legs. Using another pillow, she can hug with her upper arm positions in her comfortable fetal pose. So, kind of like she's laying down to go to sleep. She's getting a massage. Just as long as we're supporting everything, support the belly, support her head, make sure she's got her spine in a fairly neutral position. She's not leaning too far to get to it or propped up too high away from it. you know, and it might take some adjustments for, you know, even though you have the same bolsters and pillows for a pregnancy massage, you might have to alter it and add additional or take some away person to person. So the supine position. If the client chooses a supine position after around 22 weeks, arrange pillows or a foam wedge under her back to support her entire torso in a semi-reclining, which is 5 to 70 degree position. Place enough supports for her head to align her head and neck, and place pillows or bolsters 8-inch or higher or 20 centimeters or higher under her knees to take the strain off her low back and abdominal muscles. During part of the second and third trimester of pregnancy, use of this semi-reclining position to prevent weight of the fetus from pressing on the vena cava, impeding the return of blood flow and potentially causing harmful and uncomfortable drop in maternal blood pressure. So when we get further progressed into the pregnancy, having her in that position can take the weight of the baby and press it against the blood vessels. And so if we crimp a blood vessel and it can't have the same space, it's going to change blood pressure, right? So that's when we would alter our position to where she'd be in a better setting, excuse me. All right, and the sideline position. The sideline position is most comfortable and common position used for pregnancy massage. Pillows and bolsters are used comfortably to support the head, abdomen, upper leg, and arm. Ask the client to indicate if she becomes uncomfortable at any time during treatment. Right? Like they said earlier in the section that she's not comfortable laying for long periods of time, 45, 50 minutes tops, right? So if you're gonna do a 50-minute massage near the end there, where the way she's laying might start to get uncomfortable. So you just want to check in, make sure that all the pillows are still in place, nothing kind of slid out of the way, that she's still in the most comfortable position possible. And like you would do for any client, you know, just keep adjusting and changing the pillows to where they're comfortable. Mm-hmm.
So I didn't hear you correctly earlier. You said that it's a like certification. Like, do you mean CEU, or is it like a whole nother course I had to take for prenatal?
You can do a CEU on prenatal massage.
Oh,
okay. The prone position. During the first 2 to 3 months of pregnancy, the prone position can be used, but only if the anterior superior iliac spines are preventing pressure on the abdomen. So, it means if your hip bones meet the table and protect the fetus, right? If it is, and if it is comfortable. So some women may feel uncomfortable with the pressure on their belly. Some women feel uncomfortable lying on their stomachs early in their pregnancy due to breast tenderness and sinus congestion. There are commonly commercially available cushions, bolsters, and tables specifically designed to safely and comfortably support the mother in side lying and prone positions. Prenatal massage therapy instructors have varying options and rationales about their use. I've also seen where they've come up with a recess for the belly in the table, to where that if you're further into your pregnancy, you can use a prone position. All right. Body areas subject to discomfort. We talked about this a little bit ago. During pregnancy, the neck, upper and lower hips, legs, and feet appreciate special attention. The upper back and neck often feel strained because of shallow breathing, and the head forward posture that is common during pregnancy. Tension in this area can lead to tension headaches. The neck is most easily accessed with the client in a semi-reclining or side-lying position. Right. And in the figure there to the right, we can see how she's easily accessing her shoulders and her neck. Right. They don't have to be neglected just because they can't lay in our prototypical positions. Let's go ahead and turn the page. The lower back and pelvis experience extra strain, especially in the later stages of pregnancy, owing to extra weight of the protruding abdomen and the hormonal changes that soften the ligaments in preparation for giving birth. Massage to these areas can be applied in the side lying position. Lateral and abdominal muscles are also under strain from carrying extra weight and from stretching to accommodate the growing fetus. This is one of the reasons why that I'm going to go ahead and highlight from here, any deep massage techniques directly contraindicated during pregnancy. I'm going to stop your highlight. Abdominal massage is restricted to very light gliding movements, usually during the 2nd and 3rd trimester. And go ahead and highlight here. Always ask for and receive permission from the client before applying abdominal massage. Avoiding all abdominal massage in the 1st trimester may be wise to possible implications should miscarriage occur. Most therapists I know avoid prenatal massage, doing prenatal massage in the 1st trimester. So it depends on the therapist and it depends on the client, but as far as I know, most of them I know prefer not to. This is the associated risk in elevated miscarriage. You know, when you get to that 12-week point, you reduce the risk of miscarriage by several percent. And not to say that massage would cause miscarriage, but if that was the only distinguishing factor, that is what they would turn around and associate with. So kind of like a CYA, make sure that you don't associate yourself with it. So 2nd and 3rd trimester is usually where you'll see lots of people coming in for prenatal. All right, where did we go? The added weight and reduced activity that accompany pregnancy often result in fatigue and minor swelling in the legs and feet. Regular, gentle massage of the feet and legs may help to reduce fatigue and swelling. Go ahead and highlight here. If edema is limited to the lower extremities, it is acceptable to massage with superficial gliding or lymph massage them. And the highlight. If the edema is throughout the body, the massage should not be done without consulting your client's physician or midwife. Pitting edema is a contraindication for massage. The client should be referred to a healthcare provider. Does everybody know what pitting edema is when I say that? No? So are we familiar with edema when we see people retaining fluid, right? Pitting edema is where if I was retaining fluid and I pushed my finger in, that divot where my finger was would stay, right? That's pitting edema. That's meaning the fluid can't move well either. And so if that is present, that's a contraindication. I'm gonna need you to see your physician first before we can proceed. You know, and like we said, there's hormones abound and people may become upset, but you've got to protect yourself and your license, and you've got to protect them as well. They may not have the information to know, like, hey, that could be dangerous for you. So it's always good to educate your clients as well as you can, or send them to someone who can educate them, like their doctor. So, contraindications for prenatal massage. Some special considerations must be taken when performing massage on a pregnant woman, particularly if the pregnancy is not proceeding normally. Start a highlight here. If there are any health concerns, obtain permission and recommendation from the woman's maternity health care provider before providing massage services. Some therapists prefer to get permission for all their maternity clients. So before they'll even begin a massage, you've got to come in saying, my OB said this was okay. You know, and that gets attached to all the paperwork. You know, documentation, documentation, documentation. Over document. You'd rather have it and not need it than need it and not have it. Before beginning prenatal massage, ask the expectant mother whether she is expecting any medical complications or if she is at higher risk than normal for such complications to occur. Like I said, highlight this. When in doubt, refer to a medical professional. All right. Contraindications can include the following. They do include the following, and highlight all of those. Morning sickness, nausea, diarrhea, vaginal discharge or bleeding, abdominal pain, and decrease in fetal movement. Okay. Problems can occur during pregnancy, and the expectant mother should be under a physician's care regarding diet, exercise, and massage. Many physicians recommend massage for its therapeutic effects during pregnancy. However, therapists who do not have comprehensive training should be especially conservative when applying these guidelines and with expectant women whose pregnancies are not proceeding normally. A few other contraindications and precautions are discussed in the following sections. Gestational induced hypersensitive, I missed our label, preeclampsia. Gestational induced hypersensitive syndromes or pregnancy-induced hypertension, PIH, are contraindications to massage until patients with these conditions are evaluated and approved by their physician. Left untreated, high blood pressure can worsen to preeclampsia, a condition sometimes occurring in the latter half of pregnancy. Go ahead and highlight this, characterized by hypertension, systemic edema, and protein excretion and imbalances. And end that highlight. Indications of this condition that therapists might notice include system-wide swelling, blanching and pitting edema, or excessive weight gain. This condition worsens to eclampsia. The expectant mother sometimes suffers severe headaches, dizziness, and possible life-threatening convulsions. When preeclampsia or eclampsia is suspected, the expectant mother should see her healthcare provider without delay. Varicose veins. Varicose veins are often a problem during pregnancy owing to the effect of progesterone and relaxin in the blood vessels and to the increased pressure in the main blood vessels that return blood from the legs. Light gliding can be done around, but not on affected areas. Remember, these are more likely to develop blood clots. All right, so we don't want to do deep pressure where we're seeing varicose veins because we could dislodge a blood clot. Deep vein thrombosis. Pregnancy increases the chance of deep vein thrombosis, or DVT, especially in the legs because of the hormonal changes that favor blood clot formation. Having DVT during pregnancy increases the risk of it occurring in subsequent pregnancies. DVT symptoms include pain, swelling at the blood clot's location. Blood clots can also cause redness and tenderness around the site, but not all clots have observable symptoms. Owing to the possibility of DVT, deep or heavy massage in the legs, especially the medial leg where the deep veins lie, is avoided during pregnancy. If signs of DVT are present, refer a client to her doctor. So we're seeing a theme here. If we're seeing any of these contraindications, symptoms, or signals pop up, CYA, send her to the doctor, right? Maternal concerns by trimester. Physical changes that the mother experiences and development of the fetus are continuous throughout the pregnancy. However, for the sake of discussion, the term pregnancy is divided into 3 trimesters, each being about 13 weeks in length, for a total of approximately 40 weeks. During each trimester, there are unique concerns for a mother and special considerations for providing massage. So the first trimester, weeks 1 through 13. Early in the first trimester, the woman might not know she is pregnant, although hormonal changes are already happening. About a week after fertilization, the embryo embeds in the wall of the uterus. Hormonal changes cause the breast to enlarge and become tender or sensitive. Often the woman experiences nausea, especially in the mornings, but sometimes throughout the day. Mood swings, fatigue, and sensitivity to certain tastes or smells. Go ahead and highlight this next part. During the first trimester, the mother is at higher risk of having a miscarriage, which is a natural termination of the pregnancy before the fetus has reached viability. Because of this, many suggest that a woman should not receive massage during the first trimester. End highlight. Generally, healthy women during a low-risk pregnancy enjoy and benefit from massage throughout pregnancy. If there are conditions and factors that increase the risk of complications, massage should be postponed until written permission is obtained from the physician. Practitioners should have more knowledge than is provided in the scope of this chapter. High risk factors include, but are not limited to, the following. Let's go ahead and highlight all these bulleted points. Mother's age, under 20 and more than 35 years. Some sources specify under 17 and more than 40 years. Complications in previous pregnancies. Previous spontaneous abortions. Multiple gestations. Maternal illnesses such as asthma or other pulmonary disorders, diabetes mellitus, chronic hypertension, cardiac, renal, connective tissue, or liver disorders, or a history of DVTs. Rh negative mother or genetic problems include, I'm not going to try to pronounce that. I don't think I've ever been able to pronounce it. DES, exposure, and other uterine abnormalities. Fetal genetic disorders, drug and other hazardous materials exposure. Massage considerations for the first trimester. Avoid all abdominal massage or stimulation of any reflex points throughout the body that are traditionally stimulated with acupuncture or acupressure to promote uterine contraction. Avoid any points in the feet or legs that are related to uterine or ovaries. If the client is experiencing nausea or morning sickness, schedule a massage at the time of the day when the symptoms are minimal. Avoid any rhythmic rocking movements that might exacerbate nausea. They don't want to feel like they're on a cruise ship. The primary focus is on relaxation. Massage movements are used to reduce stress, provide relief from pain. Areas to work include upper back, rib cage, shoulders, low back, and legs. Any questions about first trimester massage? No? Pretty good? Second trimester, which is 14 to 26 weeks. In the second trimester, the fetus grows about 3 inches long, from about 3 inches long to about 12 inches, and the mother starts to show. As her abdomen begins to protrude by around week 20 to 22, the mother can feel the baby move. As the uterus grows, connective tissues are stretched to their limits or beyond, and often the stretch marks begin to appear. The growing uterus begins to put pressure, lost my place, on the blood and lymph vessels in the pelvis, contributing to edema in the lower legs and feet. The body also starts to produce a hormone, relaxin, which softens connective tissues throughout the body, making more room for the fetus and preparing to give birth. Go ahead and start a highlight here. Because relaxin also softens ligaments and other joints of the body, massage therapists must use caution when performing range of motion exercises to avoid overstretching the tissues. Right? So if their ligaments are softening, not just in the area pertaining to the baby, if we start doing range of motion, they may appear to have more range of motion than they normally would have, but perhaps since they're softened, they actually do not, right? And so we could be hurting more than we're helping. So we just need to be aware, very present when we're doing a massage. During the second trimester, as the fetus grows, the mother's body undergoes more changes. Among them are weight gain, an anterior shift of her center of gravity. As her abdomen grows, the mother might experience back pain, back, pelvic, hip, or leg pain, and constipation and heartburn. Massage considerations for the second trimester. The continuing fetal development and accompanying abdominal growth of the abdomen during the second trimester presents some concerns for positioning and bolstering for maternal comfort and fetal safety. During the early part of the second trimester, the supine position can be used with a small wedge under the pelvis to shift the uterine weight toward the left. However, about after the 20th week, the uterus has grown large enough, even with this modification, it can put pressure on major blood vessels in the abdomen. Because this can reduce maternal blood pressure, use of the supine position should be limited to no more than 3 to 5 minutes. A safer supine alternative is using a semi-reclined position where pillows or a foam wedge are used, or a back jack are used, that the pregnant woman's head and shoulders and entire torso are elevated to 45 to 70 degree angle, like that picture that we viewed earlier in the chapter. Another bolster is put under their knees, just like they would be regularly if they were in the supine position. Using a well-bolstered side-lying position that provides good access to neck and back and legs without protruding under undue pressure on the breast or uterus is preferred. Provide adequate support for the neck and head, that the cervical spine is aligned with the thorax and that the shoulder is comfortable without excess pressure from the weight of the torso, so that they're not crunching, laying on their shoulder and compressing it into their body, right, from the rest of the weight of their body on it. In most cases, extend the bottom leg and provide enough pillows and bolsters under the bent upper leg to maintain horizontal, so that when their legs are resting together, the top leg isn't leaning towards and putting a strain on that hip. Do you understand that? Okay. To provide a small pillow or bolster under the abdomen to support the uterus, and another pillow for the client to hug and support the upper arm. So we want to put a pillow in front here so that their back isn't that concave, or convex rather, and the front isn't concave, because they don't have anything to be against, right? So if you have them on their side, this shoulder is just going to instinctively, if there's nothing to stop it, kind of fall forward here. We're going to create a really rounded back. We want to go ahead and give them something to where they can rest comfortably and keep everything nice and aligned. The semi-fetal position is very comfortable for pregnant women at any stage of her pregnancy because it allows her to relax and talk while the therapist has easy access to most parts of her body. During the second trimester, areas of the body to massage include neck, shoulders, upper back to relieve stress. The lower back and hips are beginning to feel extra strain from the weight changes and benefit from massage. Light circulatory or lymphatic massage to the feet and legs is relaxing, and it may help relieve some of the lower extremity swelling that often accompanies a normal pregnancy. Remember that systemic pitting edema often accompanies pregnancy-induced hypertension. Watch for varicose and spider veins, and avoid all but the lightest massage where they are present. All right, go ahead and highlight this. Check for varicose veins before the client lies down because they are more visible during weight bearing. The presence of varicose veins increases the possibility of asymptomatic DVT or blood clots in the leg. So we understand that once they lie down and the blood is no longer fighting against gravity in those vessels, they'll be less visible, right? So we want to look at their legs while they're standing up, because that's gravity still taking hold and we can see them more prominently. Because of the increased possibility of DVT during pregnancy, avoid any deep massage of the legs, especially on the medial side of the calf or thigh. Use only the lightest gliding and lymph massage, and never deep techniques on the abdomen. There's kind of a theme here. All right, the third trimester, which is weeks 27 to 40 plus and birth, so 40 plus. During the third and final trimester of pregnancy, the uterus continues to grow as the baby doubles in length and approximately 20 inches and triples in weight to an average of 7.5 or 3.4 kilograms, 7.5 pounds. Big old baby. As fetal growth continues, the mother's weight increases and shifts anteriorly, often resulting in discomfort and musculoskeletal strain throughout the back, pelvis, legs, as well as neck and shoulders. The uterus can grow large enough to reach the rib cage and put enough pressure on several anatomic structures, resulting in a variety of discomforts such as the following. Go ahead and highlight this bulleted area. Pressure against the diaphragm contributes to shortness of breath and or hyperventilation. Pressure on the stomach and intestines contributes to heartburn, constipation, and hemorrhoids. Pressure on the bladder contributes to frequent urination. Pressure on deep pelvic lymph vessels contributes to edema in the legs. Pressure on blood vessels contributes to the likelihood of varicose veins. Pressure on various nerves can bring burning, tingling, or numbness. Pressure against the abdominal muscles contributes to connective tissue of the linea alba to separate. That's called diastasis recti, to allow more room for the fetus. Sometimes, owing to the pressure of the fetus, the effects of the hormone relaxin, the pubic symphysis becomes hypermobile. So we've talked about the pubic symphysis before when we talk about the skeleton. It's a very fibrous connection, right? But it has to have some flex to it. So when we have that relaxin and all those hormones that are softening things up, it makes to where the pelvis can move quite a bit while the woman is in the later stages of her pregnancy. She's got like a dang butterfly in there. All right, so late in the third trimester, the belly will drop, usually head down into the pelvis in preparation, the baby will drop, usually head down to the pelvis in preparation for birth. The mother probably begins to experience mild, irregular practice contractions known as Braxton Hicks, as uterine muscles tense for short periods, signaling the final weeks or months before the arrival of the newborn. Labor begins when contractions become more regular, last for 30 seconds or longer, and continue long enough to push against and begin to dilate the cervix. Massage considerations for the third trimester. Positioning the client during the third trimester of pregnancy requires considerations for comfort of the mother and safety of the baby. Highlight here, use of the supine position, even for a short while, should be avoided because it creates risk of blood flow to the fetus. So unlike earlier where we were worried about the reduced blood flow to mother, now we're worried about it to baby as well. Likewise, continue to avoid the prone position because it creates excess intrauterine pressure on top of the developing fetus. All right, during the third trimester, massage during the third trimester should focus on relaxation and pain reduction as it is done in the first and second trimester. The goal is to reduce anxiety and stress and relieve the strain on weight-bearing joints and muscles associated with increased weight. The lower back, hip, upper torso, shoulder, and neck benefit from relief of tension. The arm and legs and feet are often increased fluid retention or edema, and begin the benefit of circulatory and lymph massage. In the third trimester, the stretched muscles of the skin and abdomen can benefit from superficial gliding. The baby might respond by moving or kicking. All deep massage to the abdomen and medial legs is contraindicated. Right? So we've all seen that prototypical, she's walking around, belly pushed out, head protruded forward, and now we've got this whole new stance using a whole new set of muscles, well, not a whole new set of muscles, we've had the muscles, they're used a whole new way. So she's experiencing strain in areas that she hasn't experienced before or not in a long time since last pregnancy, what have you. All right. Massage during labor. A physician might recommend light gliding on the patient's abdomen and other areas as a means of obtaining relief between contractions. Lower back pains may also be relieved by applying firm, continuous pressure on the sacrum. During a contraction, pressure can be applied to various pelvic regions to help reduce the pain and promote normal birth progression. Massage following birth. Go ahead and highlight here. As soon as the mother receives permission from her doctor or midwife following birth, massage can be beneficial. And highlight. In the first 6 to 8 weeks after the birth, the mother's body is going through many changes, An emphasis of the massage should be on relaxation and relief and the strains of infant care. Massage may relieve neck, shoulder, lower back discomfort, and help relieve tension. When combined with proper exercise and diet, massage may be of value in regaining normal weight and firming slack muscles. Right. Any questions about massage in pregnancy or prenatal massage? No? Okay. All right, so performing infant massage. Infant massage has been documented as a cultural activity in families passed down from mother to daughter for centuries. From Bali to Nigeria, mothers have taught their daughters traditional massage routines that nurture infants throughout the world. That's pretty cool. History of infant massage. In 1976, Frederick Leboyer, author of Birth Without Violence, published Loving Hands, which documents the flowing rhythms of the traditional Indian art of baby massage, thus bringing global awareness to this practice. He describes it as a silent dialogue of love between a mother and her baby. Some kind of ritual or ballet slowness, controlled strength, tenderness, and dignity. That's sweet. As a young woman on a quest to India in 1973, Vimala Scheider McClure witnessed an infant massage, but little did she know it would shape many years of her life. On returning to the United States, she developed a more active form of this massage for parents to perform. So with infant massage, you, the therapist, are not performing the massage. You are preparing to teach the parents how to massage their child, right? Because I don't know about you, but I don't think a baby can sign a consent form or tell you, oh, geez, too much pressure, right? So we give it to the parents. We equip them with the tools on how to massage their child. And they use what we see in figure 19A down in the corner there, an infant-sized doll. And that doll has a weighted head to where if you're holding an infant, you know, you have to support its head. It's not the same as a baby, but it's the same weight and movement as a baby. All right, so we don't need that. Who should perform infant massage? A debatable topic among infant, I'm over here on page 729, about halfway down. A debatable topic among infant massage instructors is who is best suited to administer infant massage. After reading The Vital Touch by developmental psychologist Sharon Heller.
Oh. Sorry, oh my gosh, I meant to turn off the camera.
That's okay. I thought it was a question, I just didn't understand it. You're fine. Okay. Boop, 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 boop. Most people undoubtedly are convinced that the parent or primary caregiver should share nourishing touch with the newborn. Only when advanced techniques are used or the parent is unavailable should those outside the family engage in the massage. Bonding is one of the most important benefits and it is reciprocal for both the primary caregiver and the infant. The treatment goal is to incorporate infant massage in the primary caregiver's daily infant care routine. Consequently, the massage therapist should aim to develop the primary caregiver's daily care routines and improve parent-infant communication by teaching caregivers to massage their infants. The skinship that is formed between the newborn and the caregiver has the power of cementing the relationship not only for a lifetime, but for generations. So that's like that skin to skin that they do in the hospital when the baby's first born, that bond that they have immediately. They do skin to skin with preemies where maybe mom had a rough birth and she's in the ICU and unable to do that skin to skin. They have professional baby cuddlers that go in and, you know, they do skin to skin right on their chest with these tiny, tiny babies. I'd love to do that. All right. In studies done by the Touch Research Institute, trained volunteer citizens administer the infant massage. Not only did many of the infants benefit, but most senior volunteers were noted to suffer less from depression, drink less coffee, and also felt a connection to the infants that they massaged. All right. Go ahead and highlight this header here, teaching infant massage. This information coming up is very important. Rather than massaging babies, most organizations that train individuals to teach infant massage recommend that infant massage instructors use a life-size doll to demonstrate the strokes. The parents follow along with their infants. A doll teaching technique is used to create confidence in parenting, model appropriate skills, and to demonstrate the use of firm but gentle pressure. 2 massage routines are commonly taught: a simple routine for premature to newborn infants, and a more active well baby routine. So healthy, normal baby can have this routine for 6 to 8 week and older infants. A certified instructor rather should teach both routines to primary caregiver rather than have therapists perform massage on the infant. Go ahead and highlight on the next page the bulleted points here. The benefits of infant massage include the following: bonding, creating a close relationship that endures through time. A parent who is taught loving touch in a way, caring in a way is less likely to touch abusively. Communication between infant and parent, relief of tension and pain. Humans are mammals that require total care as infants. We are helpless. Stimulation, support of the body's developmental and functional such as circulation, the digestive system, specifically gas, constipation, and colic, the immune system, and hormones. And then it just induces relaxation. You know, you make it part of their little bedtime routine. They get a bath, they get their little massage, they get their little footy jammies on, they go to bed. Sounds like a nice time. I wouldn't mind it. All right, contraindications to infant massage. Go ahead and highlight here. The parent or caregiver should consult the infant's physician if any medical problems are present that would make massage ill-advised or contraindicated. Just like adults, babies could have contraindications as well. Trained infant massage instructors should be familiar with the normal infant development, so they may refer to the family to appropriate sources if possible signs of developmental delays or other medical issues are observed. Sometimes the baby can become easily overstimulated, and so the pace might need to be slowed down and stationary touch is used. So just a resting touch so that they can calm down, that static touch that just kind of lets them know you're there. The baby's cues as to a willingness to engage in the massage must be honored. In most cases, the contraindications for infant massage are the same as for an adult massage, but there are health conditions and developmental considerations that require special adaptations and special training. All right. Communication. The baby must be willing to engage in the massage. This is not something to be done to an infant, but must be something to be done with them, just as with the adult. Because infants cannot clearly ask for massage, most instructors teach parents to ask for permission. This is done by getting the infant's attention by gently cradling the head, making eye contact, and verbally asking permission to massage. Would you like a massage? A disengaged infant is believed not to want a massage, but a consenting infant shows signs of engagement with eye contact, cooing, smiling, alert connection. Signs of disengagement: looking away, frowning, fussing, crying, sleeping, or coughing. See, that's going to be where your training comes in. The massage is going to be more beneficial if the baby is engaged with you and in a better mood. If they're fussy, gassy, just upset, they're going to not be ready for the massage. All right, so the next little bit of this chapter goes into the actual well baby massage routine. We're gonna go ahead and glide over that. And I want to come to the following page 733, becoming an infant massage instructor. Go ahead and highlight that header there. This information is important as well. Accrediting education classes for becoming a certified infant massage instructor are taught in a 2 to 4 day workshop format. Infant massage includes simple routines appropriate for non-massage therapists to perform. However, working with parents and children takes special background and communication. Child development and patient. It may sound easy to teach such a simple, loving routine, but infants do not always cooperate, nor do they operate on a set schedule. The instructor must be adaptable to chaos and scheduling, owing to the nature of unpredictability of the new family. When investing your time, talent, and energy in any training, make sure that the trainer has a professional background in fields related to child development. All right? So now we're going to get into massage for children. Most children enjoy physical touch. Many parents massage their children to help them relax and fall asleep. When you're little and mom and you're sick and she rubs your back, right? So you can fall asleep finally. Providing massage to children is not much different from providing it to adults, with some exceptions. Depending on the child's age and temperament, his attention span can be less than that than an adult. Typically, the younger they are, the shorter the attention span, although it does differ from child to child. No two children are alike. The length of the massage should be adjusted accordingly. If you've got an active one, 15 minutes maybe, right? But some, children mature at different ages. Some may be able to be present for a massage for half hour, 45 minutes. Children's bodies change differently and drastically as they are prone to growing pains. Their bone density is usually much lower, which allows fractures to occur more often. Children are fairly resilient and more prone to illness as their immunity develops. Just as not appropriate to massage indication for massage is applied to children. Children often have higher fevers than adults. The fever is always a contraindication for massage because of many changes in growth in children, disrupted sleep.
I don't know if you can hear me, but I can't hear you.
I can hear you, but not the teacher.
That's what I mean.
How about now?
I heard you that time.
Yeah, I heard you pretty
Okay.
quietly. Yeah.
Better now? I don't know what happened. Okay. Sorry. Let me backtrack a little bit. I was talking about important aspect with working with children is to notice any signs of possible abuse, such as bite marks, unusual scratches, cuts, burns, bruises that are suspicious and might need to be addressed. Reporting suspected child abuse to the proper authorities is required by law. That's called duty to inform. It is also important when working with children under the age of 18 to always have parent or guardian in the room while the massage is performed, and to have consent to massage the child signed by the parent or guardian. Right, so they are there, they sign the forms. All right. Know the benefits of working with clients over the age of 55. This might be quite pertinent to some of us and some of the demographic that we work with. What is happening? All right, hold on, guys. I'm having a conniption. Okay, that should fix it. That's better. Okay. When working with persons older than 55, it is important to determine if the client is active, able to function normally and has a great deal of vitality, or frail, unable to function normally and has limited vitality, as often age-associated illnesses. Go ahead and highlight here. The aging process affects everyone. However, the rate of decline varies according to individual lifestyle factors and genetic makeup. Physiologically, nearly every system in the body is affected by aging. We're also going to highlight the bulleted area here. The musculoskeletal system experiences the loss of muscle mass, resulting in weakness, loss of tone that leads to stooped posture, more risk of falling, and reduced ability to perform acts of daily living. The skeletal system experiences loss of bone mass and eroding cartilage at the joints, leading to osteoporosis and arthritis, accompanied by a loss of mobility and pain. Cardiac output declines as blood vessels tend to lose the elasticity, leading to hypertension or high blood pressure, while decreasing the rate of blood circulation. The airways of the lungs lose elasticity, reducing their ability to maintain oxygen levels in the blood. The risk of lung infection and susceptibility to allergens increases. A lifetime of air pollutants or smoking often exacerbates those conditions. Neurological functions also decline. The loss of neurons in the brain affect reasoning, memory, and organizational skills. Mental health illnesses such as Alzheimer's disease and dementia must be taken into consideration. And the loss of sensory receptors reduces hearing and sight. Right. This is a partial list of conditions will affect individuals at some point as they age. Chronological age may not be a good determiner as physiological age. Some 90-year-olds are in better health than some 70-year-olds. It just depends on how they live their life. So benefits to massaging clients over 55. The benefits of working with older clients can be the same as with younger clients. Clients over the age of 55 often have less physical contact in their life. You may be the only person that they have physical contact with. Right? They may be a widower, their family might live up north, you know, and maybe they just need physical contact. There's power in human touch. Massage provides the nourishment of physical touch. In addition, massage can alleviate or provide temporary relief from age-related discomforts, assist in preventing illnesses from occurring, and possibly slow the aging process. Right. Go ahead and highlight here. Good communication is essential. And highlight. When working with older clientele, take your time. Be certain to have the client's attention before you speak. If they're hard of hearing and they don't know that you're speaking, you'll get a huh, right? So you want to, you know, maybe a touch on the shoulder. Is this pressure okay? You know, we really want to make sure that we're engaging before we actually speak what we're trying to purvey. Be certain, speak slowly and clearly, communicate a single idea at a time. Don't rattle off 4 things at once and they're, what? When asking a question, allow enough time for the client to respond. Make sure you are understood before moving on. It may be repeating yourself several times, so you have to be patient. Follow a therapeutic procedure, include taking a thorough health history and assessment and developing a treatment plan. It may be necessary to obtain information from the family member or caregiver. When appropriate, obtain medical clearance from the client's physician before proceeding with the massage. If you see anything that pops up on their file that you're not sure about, don't be afraid to say, I'd like a doctor's note first. When appropriate, blah, blah, blah. An older person's health conditions or medications may change frequently, so update their health history information with each visit. Be sure to understand the mature client's needs and concerns before starting any massage session. Go ahead and highlight these bulleted areas here. Benefits of massage for older clients include the following: improve mobility and flexibility, relieve muscle hypertonicity, cramping and spasms, reduce anxiety and pain and blood pressure, promote digestion and elimination, provide one-on-one connection and nurturing touch, improve abilities to perform activities of daily living such as dressing, bathing, or climbing the stairs, increase independence. Massage helps ease the anxiety associated with the aging process and also provides a social connection. As with any client, make sure extensive client interview is done before performing the massage to ensure there are no contraindications. Some older clients I have experienced don't understand the training that we go through and what we need to do to perform a massage properly. And some may feel resistant to be giving someone that works in a spa medical information. So it's your job to inform them, this is why I need your medical information. This is what massage does. This is, you know, possibilities of things that can happen. And this is why we have to document all this. And it's for their safety, and it's so we can keep our massage license safe too. But number one, their safety. All right. Bop, bop, bop. All right, an active older client is in good physical and emotional health with mobility and cognitive abilities intact. They are often engaged in full or part-time employment or volunteer activities with good social and emotional connections. Fewer limitations and precautions are present when massaging older clients who are physiologically younger than those who are frail. Right, so, and you know that, you know the 90-year-old who's, you know, hop, skip, and peppy, and you know the 70-year-old that's mentally 90, you know, that everybody deteriorates in a different way. Where are we at here? Use extra pillows and bolsters to ensure most comfortable lying on the massage table, as lying on the massage table might be uncomfortable. While it may not be a concern for some robust older clients, consider limiting the time the client is spaced down to no longer to 15 to 20 minutes. Because breathing becomes more difficult. A side lying position may be more comfortable. Clients might need help sitting up after massage. Make sure that your client is not lightheaded before assisting them off the table. You might not work as deeply as with a younger client. The frail older client. A frail older client typically may have one or more debilitating health conditions, and their mobility and cognitive abilities may be adversely affected. Due to medication, disease, mobility, or mental conditions, they may lack social or emotional connection, resulting in isolation and possible depression. As an individual ages, some of their abilities to function decrease, which can affect vision, hearing, and mobility. Many of the suggestions in the following sessions regarding massaging people with disability or who are critically ill also pertain to frail elders. Frail clients need special care and can be fragile to the touch. Their tissues can be more delicate and susceptible to bruising, and their skin can be paper thin and more easily damaged. Something of a twisting technique might be too much for someone who's frail and has that papery skin susceptible to tears, right? So we need to be aware of that. Frail clients may need assistance getting on and off the table with undressing and dressing. be sure to ask if they need assistance. I know when I still worked in the field, I teach full-time now, I worked at Massage Envy, and we were unable to assist our clients as per Massage Envy corporate. So what we would do is ask our clients who did come with massage considerations, such as needing help undressing or assisting on the table, is bring a family member or in-home nurse with you to assist with that, because as their protocols went, we were unable to do so. And that continues down talking about modifying movements, modifying the way they're laying, adjusting their bolsters, having plenty of bolsters to position them, modifying massage and using more stationary touch and light pressure instead of gliding strokes might be preferable. Most aging adults with health concerns are under the care or more of one or more physicians and might be using several medications. But and highlight this, be sure to take a thorough medical history. The client may need assistance in filling out documents, especially those places where they go digital. You know, I don't know how many times I've handed my mother an iPad and I don't know what to do with this, right? So they may need help, you know, maybe going into a private room where you can read it to them if they can't see the font, enlarging the font if it is a digital device, helping them complete that, and not just saying, here's a clipboard, here's an iPad, just do it. You know, you want to have that compassionate air about you. Consider medications that the client is using and any age-related conditions when choosing techniques, and check with the client's primary caregiver when in doubt. Remember, it's better to have too little than too much. It's better to do too little than too much, sorry. All right, perform massage for clients with disabilities. A disability is a physical or mental impairment, usually due to injury, illness, or condition present at birth. An impairment is a physical or functional abnormality or disorder that restricts the ability to perform daily activities. All right, there are special implications for working with clients who have varying types of disabilities. Some disabilities contribute to the client's ability to navigate the massage environment, either from physical mobility limitations or from other impairments such as blindness. In most cases, the actual massage is not different, but because of the disability, some accommodations are made for the safety of the client, safety and comfort of the client. Some of the implications impede the ability to perform client intake, provide feedback during the massage. When working with people with disabilities, it is important to ask if they need assistance. Do not just assume that they do. Different types of disabilities require different accommodations to provide the most effective massage therapy session. So auditory impairment means they're deaf or hard of hearing. Clients can have complete or partial deafness that either is congenital or has developed from injury, illness, or the aging process. Because the client might be able to read lips, be sure to speak slowly, face the client when speaking, and do not talk loudly unless they are partially deaf. Right? If someone is deaf and they use American Sign Language as their mode of communication, speaking loudly to them isn't going to do anything. But if they read lips, you want to make sure you're enunciating your words, right? Because if we're speaking too quickly and my mouth is moving like this and they don't catch all of those letter shapes out of your mouth, right? It also might be a good idea to have paper and a writing utensil or laptop or tablet to communicate in writing, especially during the client intake interview and during and after the massage session. If the client is accompanied by a sign language interpreter, speak directly to the client, not the interpreter, and allow yourself enough time to translate your words. If the client is using a hearing aid, avoid putting your hands too close to it during the massage because it's going to make the device squeal. So when it loses that seal that's in the ear, it starts to send out this high-pitched squeal. Highlight here with this bulleted area, massage considerations for people with hearing impairments include the following. Point to areas where the client can place clothing gesture how to get on the table and under the sheets. Be sure to read nonverbal cues such as twitching, holding of breath, or moaning, and be ready to modify the massage. Asking the client about depth, pressure, and other things might be difficult. To get a client's attention, tap him on the arm or shoulder. You might want to set up hand gestures with your client to reinforce communication at the beginning of the massage. Maintain contact throughout the massage. Now for visual impairment, clients might have complete or partial blindness that is either congenital or developed from injury or degenerative disease. Clients who are blind might have a service dog with them, therefore make sure that there is room to accommodate the dog. Service dogs are working when in a harness. Always ask the client for permission before interacting with the animal so they not distract it from its duty. Do not pet the dog most of the time. I know it's a puppy. I had veterans with their service animals and broke my heart not to get down there like, oh, puppy! But they're on the job. They get to play later. So, if a blind client uses a cane, ask if you may guide them to the massage room. Offer the client an arm to rest her hand on, and as you lead through the facility, walk beside and slightly in front, describing any upcoming turns or stops while steering clear of any obstacles. Once the client is on the table, the massage can proceed normally, addressing soft stress and soft tissue conditions. Go ahead and highlight this bulleted area coming up. Massage considerations for people with visual impairments include the following: help guide the client safely to the massage room, guide the client up any stairs, around doors and furniture, help the client fill out the intake form and ask more detailed questions, help the client be aware of her surroundings, where she can place clothing, and where the table linens are placed. Do not move the client's belongings once she has placed them. Verbally let the client know when you leave the room and when you return. Be sure to maintain contact during the massage. All right, so now we want to talk about limited mobility. Some people may still be able to move themselves around, but they have limitations, so we need to be able to accommodate those. There's many factors that attribute to that limited mobility, such as injury, illness, pain, paralysis, aging, or weakness. Client might be using crutches, walker, a cane, or wheelchair, and might need assistance navigating the massage room and getting on and off the massage table. Make sure that your place of business has adequate wheelchair access or access for people with limited mobility. Remove any potential barriers and obstacles to create clear pathway to and in the treatment room. If the massage facility is not wheelchair accessible, it might be better to go to the client's home or mutually agreed upon accessible establishment. So your table height. We want to make sure that our table height is adequate for us to do the massage, but also adequate for them to get onto the table. A small step stool might be necessary if you don't have like a hydraulic table. I know I had some mobility restricted people that I would lower my table down quite low hydraulically to where they could just sit, get into the table, and then when I became back in the room, I could raise the table back up to the height that I wanted. Made it easier for them to get onto the table. They didn't have to hop up onto the table. That's one of the benefits of a hydraulic table. If you have that luxury, it's wonderful. If not, there's always accommodations that can be made with an adjustable table that you manually adjust. All right, address concerns. A person can experience limited mobility for a wide variety of reasons that can be explained more fully during the intake and medical history procedure. The massage can be designed to address conditions that are directly related to the impairment, such as circulatory or movement restrictions. Mobility aids such as crutches, walkers, and wheelchairs cause excessive strain and compensation patterns in the arms, shoulders, neck, and that can be addressed during the massage. I mean, if you see anyone on a pair of crutches that haven't changed in 150 years, they are gripping and have a nice tight contraction in their arms, and their shoulders are usually pushed up towards their head, right? This is a whole new pattern for someone. Plus the balancing factor on that is they're not using whatever leg, maybe they have a broken leg, right? And they've kept that in a contraction, it's stabilized in a certain way. And now all the weight has been pushed to, with the help of crutches, to the other leg. So there's going to be strain on that as well. Go ahead and highlight this bulleted area here. Massage considerations for people with limited mobility include the following. Offer to help when the client asks to be helped. If the client comes with attendant, speak directly to the client when asking questions. Help the client move on and off the table, and when turning over, if requested, try to avoid any unnecessary repositioning or turning during the massage. Have mobility aids nearby for easier access when your client needs them. That means they're crutches or wheelchairs. All right, paralysis. Paralysis is commonly due to an injury or illness that adversely affects the nervous system. The extent of the paralysis and the part of the body affected vary depending on the type of illness or site of injury. Go ahead and start highlighting here. A stroke or cerebral vascular accident resulting in paralysis on one side of the body is known as hemiplegia. Spinal cord injury or other common cause of is another common cause of paralysis. Keep highlighting. The extent of the paralysis depends on the level of the spinal cord that was injured. Keep highlighting. The higher or closer to the head that the injury is located, the more extensive is the paralysis. Keep highlighting. Injury to the cervical spine results in quadriplegia. When all four limbs, arms and legs are affected. Injuries to the thoracic or lumbar spine result in paraplegia or paralysis of the legs and lower body. End highlight. That was the big one. Spinal cord injuries are classified as complete when there is no nerve transmission through the injury site, and incomplete when some of the sensory or motor nerve activity exists and there is some sense of feeling or movement below the level of injury. That makes sense? Do we have any questions? Okay. Working with people with paralysis requires special considerations. People with paralysis usually use mobility aids such as crutches, manual or electric wheelchairs, or scooters, depending on their level of function. To provide services to this population, the massage facility must be wheelchair accessible. Otherwise, the therapist can choose to go to the client's home or another facility that is accessible. A determination must be made whether to transfer the client onto the massage table, work with him while he remains in the wheelchair, perform the massage with the client in a bed, or make some other accommodations. So that's all about positioning. You want to be able to make accommodations for them, whatever is going to be the most comfortable for them. Massage for people with paralysis is beneficial and deserves some special considerations. Paralysis usually affects only a portion of the body, limiting mobility and sensation. The rest of the body has relatively normal muscle and nerve activity, except for it can experience compensation patterns accompanied by tension or discomfort by result of using mobility devices such as wheelchairs or crutches, or adapting to life with paralysis. Because of compensating patterns from using mobility devices, a person with paralysis might have a sore back, shoulders, neck, arms. Massage for normal, non-paralyzed parts of the body is essentially the same as regular massage, concentrating on relaxation or addressing the tension created by compensating patterns. Massage to paralyzed areas requires caution. Start highlighting. Paralysis is often accompanied by a loss of sensation. Because the client cannot feel the paralyzed area, the therapist should avoid any deep techniques or excessive joint movement that might cause injury or pain. Right? Just because the nerves aren't working and they can't operate those, there's still blood vessels that we can affect, right? And if they can't feel, they can't tell us, ow, right? Because of the lack of muscular activity and movement, circulation is compromised. Connective tissue tends to stiffen, reducing flexibility. Long-term paralysis is often accompanied by muscle atrophy and joint stiffness, or even contractures. Gentle strokes that enhance lymphatic and venous circulation are beneficial. Range of motion techniques help maintain flexibility, but must be used with great caution. Go ahead and highlight this bulleted area here. Use care in helping the client on and off the table and turning over. Ask the client how to best assist them. Don't just assume, get their input. If doing massage in the wheelchair, make sure the wheels brakes are on. Be careful working on paralyzed extremities because of loss of feeling and delicate tissue. Do not perform massage if acute systemic symptoms are present, especially respiratory failure or compromised circulatory system. You might wish to do massage having the client in his own bed. Always work with the client's physician, right? So we want to get what's the word I'm looking for? Documentation from the physician. Sorry, I wanted to say computation. All right, prosthetics and amputees. A client who has lost a limb due to an injury or accident might be fitted with an artificial limb or prosthesis. The client might have in the past or is currently be receiving physical therapy. If so, work with their physical therapist and or occupational therapist can greatly enhance the client's ability and success with a prosthetic device. These clients can experience soreness at the prosthetic attachment or stump, have sore muscles that have been compensating, or postural deviations. I can speak personally to this. My father is an amputee, and when they adjust the leg, if they have it too high up, it's like having one leg higher than the other. If it's not long enough, he's leaning towards one side. So while they're transitioning, if they're newly amputated, they're going to experience some pretty extreme musculature pain. Also, where the residual limb and the prosthetic piece meet, if there's any sort of friction, rubbing, we're gonna have blisters and pain there. So those are all things to keep in mind. The client might need help getting on and off the table. Go ahead and highlight this bulleted area. Ask the client if they would like to remove the prosthesis for the massage. Ask permission to conduct the massage at the prosthetic attachment site. And use care. It might be sore if recently fitted for a new prosthetic limb. It might have limited sensation or numbness. The client might have phantom pain that can be relieved through massage and might experience some reflex relief by working the contralateral limb if present. So even though the limb isn't there, they can still feel it because the brain is still sending the signal to it. It's a really bizarre phenomena. All right, performing massage for the critically ill. Massage is becoming part of healthcare treatment for critically ill patient. By adjusting the intent and delivery of the massage session, there are no contraindications for touch therapy. Depending on the person's condition, however, some precautions and concerns must be observed. So the purpose, the intent of the massage for the critically ill patient is to provide gentle, genuine, caring touch therapy to bring comfort, pleasure, relaxation to someone at a difficult time in life. Go ahead and highlight those benefits there, and also highlight that purpose. The benefits: helps control discomfort and pain, improves mobility, reduces isolation and fear, helps ease emotional and physical discomforts, and allows the person to develop a more positive attitude. But there are considerations and precautions. As always, it is important for the practitioner to become cautious and aware of the client's needs. Conditions dictate how much can be done and which precautions should be used. When in doubt about how or whether to proceed because of the person's conditions, always ask the client first. Generally, the clients are aware of any precautions concerning their condition. Highlight this. It is also important to communicate with the physician or the caregiver in charge. And highlight. A critically ill person's physical and emotional condition is constantly changing. Continually assess the client visually, verbally, and tactually, and adjust the massage accordingly. The practitioner must be open to the needs of the person as the massage proceeds. Techniques. Many classical massage movements are designed for the relatively healthy person. When working with the critically ill, it is essential to be aware of the person's needs and tolerances. Techniques should soothe and add comfort. Touch, slow and gentle stroking, energy work are most common for massaging the critically ill. Massage movements are simplified, focusing on the intent of touch by using stationary touch, light circular friction, or compression, and lymph movements. Movements that stretch or move the skin are used with caution and only after assessing the integrity of the skin. Depending on the tolerance of the client, the length of the session might be abbreviated. Rather than a full massage that lasts an hour or more, the situation might call for back and shoulders, or just to the feet to be massaged for 15 minutes. This is the time to underdo rather than overdo. It is a time to be supportive and calming. The touch session might involve simply holding the client's hand and responding to the person. You might be the only touch that they have. So that might be all they need from you is a hand to hold, especially if you're in a hospital setting. Client feedback is often compromised during critical illness. The client might have difficulty moving or talking or giving verbal cues. And if she is heavily medicated, she might be able to let you know you are hurting her. Pain medications can alter perception of touch, so it's best to keep the pressure light. Any and all contact that is made is an integral part of the session. Your mere presence is important as the manipulation as you are, or that you use. Your actions, voice, breathing, and movements should all reflect caring, nurturing, and compassion during the session. More often than not, persons who are critically ill are touch deprived because family and friends are too fearful or uncomfortable to touch those who are ill. In the words of Irene Smith, a service through touch, we give massage primarily for relaxation and pleasure. The patients might be under high level of stress due to fear, pain, and anxiety on the physical and emotional spiritual levels. Slow, gentle, loving touch is used in order to offer the patient a time of peace and quiet. Peace and quiet and gentleness are three very valuable healing qualities. Have you ever gone and visited someone in the hospital and they had all those tubes and wires and things touching them? You know, you don't know where to touch them, right? And so the family comes in and they visit and they see all that, and you know, these people that they have in their life are suddenly afraid to touch them. So that's where massaging the critically ill as a professional comes in. You might be their only touch, because all the other touch that they associate with that might be with getting shots or moved around in their bed, or every time someone changes a dressing on a wound or something like that. All right, massaging people with cancer. Until recently, massage has been considered to be contraindicated when working with persons with cancer because of the effects the massage has on blood and lymph circulation, and the fear that massage might actually spread the cancer. Pioneers such as Deborah Curtis, Gail McDonald, and others have examined the development of cancer and the mechanics and how it spreads, and have concluded that speeding up the flow of blood and lymph is unlikely to spread cancer as movement and exercise. Is as unlikely to spread cancer as movement and exercise, excuse me. Massage precautions are designed around the factors such as tumor location, tissue instability, organ involvement, effects of the treatment, and other factors. 2 books recommended for anyone considering working with people with cancer are Medicine Hands, Massage Therapy for People with Cancer by Gail McDonald, Massage Therapy and Cancer by Deborah Curtis. Cancer is not a single disease. Because it is many different conditions, it is difficult to summarize all the guidelines here. To work safely, a massage therapist needs to interview the client, identify precautions, and develop a massage plan in line with the practices of oncology massage. A client's physician may be able to provide some specific recommendations. However, it is the responsibility of the practitioner to seek information about cancer, the client's particular situation, rather than rely solely on the physician for guidance. So that means do your research, understand what you're going to be doing. Of course, get their input and make sure it's okay that they're cleared for it, but you need to do your due diligence as well. Research and read widely on the subject and take note of all the articles, books, and entries in the massage pathology text for a sense of the volume of the information on the topic. Take a CEU in oncology massage. Highlight here, before attempting to work on people with cancer or history of cancer, most practitioners need advanced training in the specialty. Learn more about oncology massage and recognize training at the Society for Oncology Massage. There's their website. Okay. So I want to boogie on down over to page 742, and we see the massage corner 19.4, excuse me. I want you to go ahead and highlight all those bullets. The benefits of massage for persons with cancer include the following: provides some pain relief, reduces nausea, improves digestion and elimination, relieves stress, promotes relaxation, eases insomnia, reduces anxiety, provides some relief from depression, provides some relief from muscle tension, spasm, and fatigue, helps restore flexibility, helps restore range of motion, increases body awareness, restores positive body image, enhances self-esteem, improve outlook on life, improves quality of life, promotes health, feels good at a time when many things feel bad. All right. Cancer metastasis, or metastasis, excuse me, is the manner in which cancer spreads. Metastasis, or proliferation of cancer cells, is a complex process that is still being investigated in the fight against the disease. Even though modern medical practices are successful at eliminating primary tumors associated with cancer, the metastasis of cancer and other locations is usually the cause of death. By the time a palpable tumor is detected and diagnosed, metastases have already started. Cancer spreads 4 ways: direct invasion of nearby structures, go ahead and highlight this, within body cavities, through the bloodstream, through the lymph system. The 3 stages of metastasis are of concern to the massage therapist: cells breaking off the primary tumor, circulation through the blood and lymph vessels, implantation of cancerous cells as secondary sites. Cancer metastasis through the bloodstream. Cancer that metastasize through the bloodstream are often the most lethal, right? We think about the blood supply, it goes everywhere. We get cancer cells coursing through the bloodstream, and those sites attach and start to metastasize. Cancer cells from a tumor slough off and pass through the walls of the blood vessels that feed the tumor. Mechanical processes such as direct pressure and intense movement close to the tumor could theoretically promote cell shedding from the primary tumor. Therefore, massage, stretching, or joint movements on the site of the tumor are contraindicated, especially if the tumor is in superficial tissues. When cancer cells enter the circulatory system, they enter a very hostile environment in which fewer than 1% of the cancer cells survive. Factors that cause their destruction include the following: cancer cells cannot absorb nutrients while moving through the bloodstream. The immune system is designed to seek and destroy abnormal cells. Cancer cells cannot withstand the turbulent forces of movement in the circulatory system. The longer cancer cells remain in circulation, the less likely they are to survive. Fewer than 1% of metastatic cells from a tumor survive the bloodstream, and fewer than 1% of those cancer cells are able to initiate a metastatic process. Cells can clump together and increase their chance of survival. I also want you to highlight Massage Corner 19.5. Massage is contraindicated for persons with squamous cell carcinoma. a form of skin cancer. If a massage practitioner discovers a suspicious lesion, the client must be referred to a dermatologist immediately. A client who has been recently treated for a squamous cell carcinoma should obtain an approval and a release from a physician before receiving massage. Review Chapter 5 for more discussion of skin cancers and tumors. So they might not see their back and you may. So anything that pops up, if you see them regularly and it changes quickly, tell them to see the dermatologist. I recommend everybody sees the dermatologist all the time and be best friends with them, but that's just me. Let's move on down to the next page. And where we see classifications of cancer, I want you to highlight cancer is defined by type, grade, site, and stage. The type of cancer is determined by the kind of tissue in which the cancer cells begin to develop. I'll go ahead and highlight that bulleted area there. Carcinoma originates in the epithelial tissues that line the organs and vessels. Myeloma originates in bone marrow. Sarcoma originates in the supportive and connective tissues such as muscles, cartilage, and bone. Lymphoma originates in lymphatic tissue. Leukemia originates in tissues that form blood cells. And on page 745, we see the stages. Stage defines the growth of most cancers. This is probably terms that we've heard of in passing, might be familiar with. Stage 1, cancer is still small and contained in the original tumor. Go ahead and highlight here. Stage 2, cancer has grown or is spread to nearby lymph nodes. Stage 3, cancerous cells have spread to regional lymph nodes and other tissues in the area. Stage 4, cancer is well developed and is spread to other tissues or organs in the body. Then we have recurrent cancer that is returned after being treated. It might come back to the original site or another part of the body. End highlighting. Another classification scheme of staging considers the cancer distribution in terms of primary tumor, just T, regional lymph node involvement, N, and the extent of metastasis, M. The T component indicates the size and invasiveness of the primary tumor. The N component indicates the absence or extent of invasion of cancer cells in the regional lymph nodes, and the M component indicates whether the cancer is spread to other parts of the body. So T0, no evidence of tumor. T1 through 4, increasing tumor size. Go ahead and highlight these bullets. Node and X, lymph node involvement cannot be assessed, and 0, no evidence of lymph node involvement, and 1 through 4, increasing degrees of lymph node involvement. And then we have metastases. M0, no evident of distant metastasis, M1, evident of distant metastasis. Why don't you go ahead and turn the page to intake procedure, persons with cancer. During the intake consultation, a medical history is taken to gather information about the client, the type of cancer, stage of cancer, and of course the treatment, type, and schedule. The side effects of the treatments and the names of the treating physicians, the level of health, stamina, emotional state of the client. Become informed as possible. Learn the kind of cancer, where it is, location, where it is located, primary, secondary sites, areas where the particular cancer tends to metastasize, organ involvement, and the symptoms of the cancer, neuropathy, pain, fatigue. Specific questions should be aimed at lymph node involvement or removal, radiation therapy, effects of cancer treatment, years or even decades later, tissue stability, medications, or medical devices. Go ahead and highlight here. Questions that cannot be answered by the client can be referred to the client's doctor. Okay. Let's go on over to the next page. Where we see the surgery heading. I want you to come on down where we see the site of surgical incision. Right? The site of surgical incision is the local contraindication unless the therapist has specific training in working with scar tissue and adhesion and has the physician's approval. Reasons, highlight here, reasons for a site being contraindicated include the following. Highlight these bullets. It is the site of a recent tumor. The tissue is actively healing. There may be clotting. It may be still inflamed or irritated. The next couple pages talk about chemotherapy and the effects of chemotherapy. We're not going to go into that right now, but what I want to go to is page 750. And we see guidelines for massaging a persons with cancer. I want you to come about halfway down the page before we get to the bulleted area and highlight this paragraph here. As stated earlier, most massage therapists need advanced instruction in massage for people with cancer to carry out massage safely and effectively. Before attempting it, seek out the Society for Oncology Massage and the many articles, books, and courses devoted to this topic. Become knowledgeable about specific guidelines, interview questions to ask clients, make decision-making steps, and the massage plan and hands-on adjustments. Go, if you are interested in working with people that have cancer, you need the proper training. With most fields in massage, you need additional training. You want to be as informed as possible because they are a vulnerable population, right? Come over to the following page, 751, where we see friends and family of cancer patients. Spouses and close family members, go ahead and highlight this, with cancer are also under increased stress and can benefit from massage. Many times, family members who are part of the client support group can be taught simple or specific massage techniques so they can provide caring touch to the person with cancer, but on a more routine basis. This not only provides additional comfort to the client, but also empowers family members by giving them something positive that they can do to support their loved one. All right, and finally, we want to talk about hospice. I know we're running pretty short on time, guys, so we'll try and get this done in a timely manner. So hospice is a recognized program of compassionate care that takes place in a facility or a patient's home for an individual who is terminally ill and is expected to die within 6 months. Go ahead and highlight here. During hospice, the individual receives palliative care that is designed to ensure comfort, support, but not a cure. So they are going to die. You're caring for them while they die in the most dignified way possible. It's a very powerful realm to work in. I think everybody deserves to die with dignity, and lots of hospice places accomplish that. Hospice also includes psychological, emotional, and spiritual counseling for the patient and close family members. People who have acquired the services of hospice, either at a hospice center or a home hospice care at the end of their lives. The goal at this point is not quantity of care, but quality of care. The goal is to make the patient as comfortable by reducing pain and as comforted, having someone to give empathy as possible. Hospice professionals help comfort family and friends and often help the patient and loved ones deal with the transition and grief of accepting death. Life-ending illnesses include advanced stages of cancer, organ failure, degenerative diseases, severe trauma or injury, neurologic disorders such as Parkinson's, amyotrophic lateral sclerosis, Huntington's, or stroke, complications from severe eating disorders, malnutrition, and any number of other life-threatening illnesses. Signs of approaching death include reduced food and water intake, pauses during breathing, and increased sleep patterns. The body goes through a process when it dies. You have to allow the body to go through that process. And when they're in hospice care, they stop all of those mediating efforts to prevent death and instead make the client as comfortable as possible. It's very, very noble work. Not for me, I'm a raw nerve. I look at a hospice house and I'll cry. But I know a couple therapists that said it was some of the most, where they felt the most pride in their work because they helped someone transition comfortably into death. And I know that sounds macabre, but it's very powerful work. So, massage during the end of life care. In advanced end-stage disease, many massage may provide comfort and ease isolation. Highlight here. Massage during hospice is gentle and soothing. Any deep or painful techniques are avoided. Benefits of massage during hospice include reduced pain and anxiety and increased relaxation, improved sleep patterns, and enhanced awareness of the body-mind connection. Although care and gentle work are imperative, it is the premise that quality of life, not quantity, governs which kind of massage is performed. This work is not for the faint of heart. Working with someone who is about to die requires grounding and shielding, as well as strength and compassion. This is a time to respect and honor the weakening body and provide compassionate, gentle massage to support it. Often, the patient can only tolerate 15 to 20 minutes of touch. Only gentle gliding movements, light compression, feather stroking, working on hands and feet, simply holding the client's hand, or energy work is indicated. Energy work, such as therapeutic touch, Reiki, might help a dying patient accept death as a part of life and may provide enough solace and tranquility to pass on. Your own spiritual philosophy and beliefs must be set aside in respect for theirs. This is a time to say goodbye to any remnants of a healer's ego, and it's a patient's journey. Many of the same precautions apply to caring for someone at the end of life, i.e. one with life-ending illness that will not heal and who has no other medical treatment options for cure, as to treating someone who is critically ill. Careful massage precautions continue and are even amplified as the client approaches end of life. Highlight here. It is absolutely important to work with the hospice caregivers and physicians, and highlight. The involvement of family and friends is also important. Often the patient is heavily medicated to cope with pain, and the gentle care must be provided. Maneuvering around IVs and working on a patient within a medical bed, i.e. a hospital, hospice center, or even in a patient's home, may be necessary. Self-care and attention to your body mechanics are important when you're working wherever the patient happens to be most comfortable in their bed, lounge chair, or couch. The family might ask they be left alone with the patient to die. This must absolutely be honored, especially to say goodbyes. Highlight here, always ask if the time is appropriate to administer massage. Sometimes providing massage for the family and visitors can also be supported and welcome, but always ask first. Grief counselors available to family and visitors are sometimes present to help caregivers, including massage and touch therapists, work through very real grief they felt when a patient has passed. You have a connection when you have that hand-to-hand touch, the power of human touch. So when they pass, you will feel it too. By considering the current needs and conditions of the person when they are seeking massage, therapists can make accommodations, choose techniques, and make modifications to create a massage experience that is rewarding and beneficial. Throughout life, from the earliest weeks to the final stages, massage effectively provides comfort and relaxation. And a minute over, I'm sorry guys. I tried my best. I do want you guys to do, I know we ended on kind of a low note, but hospice and palliative care is very, very important. I do want you to do the questions 1 through 19. Go ahead and send them to massagetl@sunstate.edu. If you have any more questions about today's lesson, you can hang on and ask those, or shoot me an email later today, and along with any other questions. Before we go, do we have any questions? Everybody feels pretty good? We just need special considerations for special populations.
You said 1 through 19. What page? I just lost it. Hold on.
752 to 753.
So do we just like write them, take a picture, and send them to you?
Yeah, you can do that. You can throw them in a Word document, whatever works for you.
Okay.
All right, cool. So we will see you guys on Tuesday. All right. Have a good afternoon. Oh, how do I stop?